Everyone. So, hello everyone. Today we have an A&E consultant coming in to talk to us about what the route to medicine is like, and specifically when you start getting into medicine, what it's like to become a consultant and how you would do that. And without any further ado, I hand over to you, sir.
Thank you. Thank you for having me in your forum. I'm going to be talking about, well, I hope everybody can see the slides, talking about emergency medicine and basically what we do in emergency medicine, because I am an emergency medicine consultant, and what we do in emergency medicine, and what are the routes to become an emergency medicine physician or a clinician. So I mean, just a disclaimer. Some of the images may be a bit upsetting, but I hope you all will be able to get on with it. Okay. So without further ado, just a brief about you guys. What's your level of, I mean, you all are students, you all are, which year? That just gives me an idea about how this, all of you are GCS plus, or a little, or some of you are, okay, so you're all year 12, year 3. Okay, fine. So there shouldn't be any problems. You should all be okay with what I'm going to talk about. So first of all, I'm going to talk briefly about what is emergency medicine, and get on with the other bit. So everybody can see the slides? Yeah? Just raise your hand if you can see the slides, okay? Yeah? Good. Yep, okay, good. Right. So just a brief about where I work. It's not a very big hospital, but it's only a small hospital. Just one second, just close the door. It's a small hospital. It's a small hospital. It has been rated one of the outstanding hospitals in 2018. Since then, we have fallen down the leaderboard, but we are still there. We're still one of the better hospitals in this country. It's a small hospital, but we do things slightly different to other hospitals. And I'll just go on to the next slide, which talk about where this is situated. So this is the Cambridge University Hospital jurisdiction, or the coverage. And our hospital is right in the east. It's called the West Suffolk Hospital. So you see where the Cambridge and the Suffolk is meeting. It's just over there. So we are about 20 to 25 minutes away from Cambridge, which is our main referral hospitals. And we get a lot of medical students from Cambridge coming to our hospitals for training and further development. So I am also the lead for the medical students coming to our emergency department. I look after them. We plan things for them. So if anybody has any questions at the end of the session about what medical students do and things like that, so we'll talk about that if anybody has any questions about that. Moving on. Okay, so this is the definition of, I'm going to let you read it because it's too big. It's the definition of emergency medicine. Okay, I'm going to pause a minute for you guys to read it, because I'm not going to read it. That's what actually it means. It's basically a mission of the last bit. If you can see the last bit, is a mission of managing and treating and preventing the acute and the unexpected illness and injury that comes that happens during that comes to the hospital. Okay, the rest of it is the actual formal definition. As you all have learned so many definitions for your 12 plus. This is basically doesn't mean much to me. It is a formal definition. Moving on a bit. What we do as emergency physicians. This is a small clip I'm going to run. It'll give you a brief about what we do.
Listen up, everyone. 2-year-old male found unresponsive in bed, not breathing, approximately half hour ago. It's been a nightmare today. No beds, nothing at all. 2 minutes, stop, 1 second, stop. Asystole. It's been in asystole throughout. Continuous CPR, please. And next cycle is adrenaline. So it's not looking good so far.
I'm just here to help you.
Yeah.
You're in hospital. I'm one of the nurses here.
Yeah.
All right? We don't want to do any bad to you. Just want to help you. Make sure you're all right.
All right. That's very considerate of you.
Most of us imagine that A&E deals with stereotypical medical emergencies, but it treats a vast range of patients with problems of all kinds.
Have you got children at home?
Oh. No, I haven't.
You did?
No.
Right. Would you have a seat for me, Donna?
Killed them all.
Donna?
Get them away from people like you, huh?
We're calling the police because we don't know what's going on in her home. She's talking about self-harm and arming the others as well with knives, so we don't know what was left behind. So, and she's quite distressed as well, so we need to make sure everything's fine at home. All right?
Yes.
Have we got a deal? Yeah?
No, we haven't got it back.
The challenge is
So, I mean, you guys can unmute this. You can feed in what your thoughts are. That's it. So this is kind of what is actually happens. We just don't just treat emergencies. We do deal with lots of other things, and that includes severe bleedings, major trauma, cardiac arrest, breathing difficulty, broken bones, mental health problems, and self-harm patients. So this is a picture of a trauma that's come in. I've just tried to keep the picture, not so disturbing, but that's kind of scene that is also happening, along with simpler things like you see over here, like a broken bone there. So what we do, and so if you have this, we give local anesthetics and things like that, see. This is one of our advanced nurse practitioner, and she's setting the bones and putting a plaster, and you can see. Can everybody appreciate the difference about what was the initial bit and how it is looking now? Go back a bit, just in case. Just so this, you see this bone over here, how it is jammed up, and what she has done is managed to do what we call a manipulation, and you can see it's nicely set now, and the bones have been set properly. Okay, so this is just an example of the various things that we do as emergency medicine physicians. On top of it, we have to treat, just run this clip for a bit. We have a challenge of 4 hours. And that is basically the biggest challenge that we have at this point. Yeah, I mean, the thing is that what happens with, I think there's somebody trying to say that should be unmute or not. You can actually unmute and give your feedback. It's basically because everybody starts talking at the same time, it becomes a problem. Okay, I'm just going to move forward. So this
A&E
is...
departments in the UK are expected to meet a 4-hour target to see, treat, make a decision and act for every patient. Failure to meet this standard results in what's known as a breach. Last year, Queen's Hospital A&E departments in the UK.
So you saw this clip here. There was this. They were talking about different hospitals, and at this point, many of the hospitals are failing to get to the target of 4 hours, where we treat, make a suitable plan, either discharge or keeping in the hospital within 4 hours. This is unique to UK. Okay, this 4-hour target is not applicable if you go to America, if you go to Australia or any other country. So that's the thing about that's the thing about this 4-hour challenge. What was I saying about 4-hour challenge? So we are at the moment with our resources and everything, we are struggling to meet this 4-hour challenge. We're doing all right. Our hospital is doing all right. The hospitals are measured how they meet the target, whether they're achieving the 4-hour targets or not. And then there is a leaderboard table made, and that decides which hospital is better and which hospital is poorer. Besides all this, we also do a lot of teaching. I'm doing a simulation for my junior doctors. This is basically, it's a drill. If an acutely unwell patient comes in, how we are going to manage that. So this is a drill that we would practice because if we practice together, we actually get a better output. So that's why we do lots of practice, lots of teaching, and we also have fun. So this is we have gone to a conference together as a team. As you see, my whole team, we are in an international conference presenting our research work that we are doing in our department, and also having fun. Basically, you ought to have some fun as well. So that comes with it. So we enjoy that. A brief about how do you become a consultant in emergency medicine. So you start as a medical student over here, and then you do year 1, year 2 is your foundation year. Then you have 3 years of ACCS training. We say acute common stem training, which includes general medicine, anesthetics, ITU, and emergency medicine. So you have to do all these specialities. Then you are kind of nearing your goal of becoming an emergency medicine, what we call an ST3, then followed by an ST3, where you do pediatrics. Why they have broken down into this is basically pediatrics and a musculoskeletal. It can vary. Some hospitals will provide this pediatric training in their emergency hospital, in their emergency department, and some will provide, as in some, they will have to go to the pediatric department to get that training. And then followed by another 3 years of higher specialty training, which is basically emergency medicine and learning various, and you probably will be rotating to all the hospitals in the region. As I showed you in the first slide, we'll go back to the first slide. And then you'd have to do a few exams before you become an emergency medicine consultant. Okay. I was asked to talk about COVID because I believe some of you are interested in what we did and how we deal with COVID. So I'm going to just show you a small clip, which I was basically preparing to show my other colleagues in other parts of the world how we prepare for COVID. So I'm just going to, it's a small clip. I hope you...
Hi friends, this is my hospital. Welcome to my hospital. This is Chi. We've got Surabhi with me. This is our COVID assessment area. This is the way where we would go in and put on a PPE and then walk into the room. Taking one of these, giving it a nice wipe, and a piece of paper. So now you are kind of, looks nice, shiny, clean, and ready to go. We're using here
So it's basically we're talking about various types of PPEs and things like that. That's why.
The COVID area is fully prepared. Cow has got an FFP3. Basically, this is the COVID area. This is the rhesus area and the COVID area. We don't have a patient just about now in the rhesus area. The rhesus area has got all the rhesus equipment, an X-ray machine, and at the back there is an ultrasound machine which we use for assessment and triage of the COVID patients. This is the patients in the COVID area. There are 3 beds there and 3 beds on either side. We will be assessing the patients here before they go to any particular ward. Thank you.
So I think I got my son to do the editing, so he wants to put his credits in there. Well, okay. So basically that, and this is my team here. You can see this is last Christmas. If you had we are all dressed up for Christmas, and basically those who are from Indian origin wish you a very happy Independence Day. Your microphones so that I can take your questions. I have one question. I would somebody put a question in the chat box, and why ultrasound? So I'm going to first answer what happens to hospitals who frequently fail to meet a 4-hour target. Okay, the thing about hospitals are, initially there is a they used to have a penalty for patients for if the hospital continues to breach 4-hour targets. You don't get additional funds if you're not meeting the targets for various equipments, various development and things like that. That happens the second stage. The third stage, it is basically like you have Ofcom, we have the CQC in inspecting the hospitals. And if the CQC continues to downgrade and put red alerts for the particular hospital, then the hospital goes into special measures. When the hospital goes into special measures, there are inspectors from different parts of the country sitting over your head all the time, trying to see what you're doing and things like that. And nobody really likes too much of people telling them what to do, what not to do, and things like that. So that's where the 4-hour targets becomes important. But because we haven't been meeting the 4-hour targets, all over the country, not our hospitals, that 4-hour targets, they have made it much more lenient. Now, I think the government is actually thinking of taking away the 4-hour targets. There is a plus side to it, and also there's a negative side to it. The 4-hour targets, if it is taken off, means there would be longer waits in any department and things like that. The plus side is that we will have a more opportunity to treat patients and things like that. So I think that debate is a bigger debate when you guys become doctors and when you guys are in actually doing the job. So the 4-hour target, the importance of 4-hour target, it will be a time for you to discuss what the importance of 4-hour target. Okay, take this. There's another thing about why choose emergency medicine, or why did I choose emergency medicine? Well, the thing is that emergency medicine, the big part about emergency medicine is that it allows me to practice the whole breadth of medicine. So it's I'm not just restricted to treating eye patients. I'm not just restricted to treating heart patients. I'm not just restricted to treating, I don't know, maybe vascular patients and things like that. I'm seeing the whole breadth of the of medicine, and I'm able to practice some key practical skills, and that's important for me. That's a big differentiation for me, and I'm also, it gives me a lot of satisfaction, basically, when I have been able to instigate the right treatment at the right time early on, and which has made a big difference to the patient's outcome in future. Okay, so let me take some more questions. How would you say the pandemic has changed the way of your working, and what have you learned? Right, a lot of things, way of working. Let me just one sec, I'll answer that question. There's quite a lot of questions, which is great. I'm going to answer all of them. Let me answer this question. I think I'm taking too long to answer your questions, but I'll answer this. How has the pandemic changed my our way of working? Okay, so let's be honest over here. Before the pandemic, we had no clue about how to manage COVID patients. I mean, when it hit us, we had no clue. We had conflicting reports coming in telling us that probably hydroxychloroquine works, probably this drug works. Also, we were hearing that this PPE is absolutely necessary. There is a high risk of medical personals getting COVID and having a bad outcome with it. So we were scared as well, not just not that we didn't know about the pandemic. We were also scared for our own safety, our staff safety, our colleague safety, and I would say we had we are the lucky hospital because we instigated as senior clinicians. We made a big decisions that we would be having adequate PPE for our staff, and we had a very, very good outcome in the sense that not many of us tested positive. Although they tested positive, some of us tested positive, but not many of us tested positive. And amongst the people who died, we had one locum registrar. He wasn't working with us at the time of COVID, but he used to work in our hospital prior to COVID. Unfortunately, he died, and we were very upset about it. And we thought if he had worked with us, maybe he wouldn't have had this bad outcome. He was working in one of the London hospitals where I think he probably didn't get enough protection and things like that. So how has it changed my thinking? Well, we are anyway doing that in the sense that we are kind of prepared for we have been all these years we have been drilling for the unexpected, and we are preparing ourselves for the unexpected. But what we have learned that sometimes this unexpected could be of that magnitude that you cannot comprehend, and you will have to use your common sense, and you will have to use the tricks that you know the best, and the tricks that are embedded to you over these many years of training that you have undergone. I hope that answers your question, because there's lots more questions. I'm going to move on to that. since your career in medicine, what have been the biggest problem you have faced, and how have you overcome the problem? I'm not going to answer that question. The reason why I'm not going to, the biggest problem and the challenge that basically I've kind of answered this question in a way. That's why I'm not answering it. Is the decision of going and taking up a specialty, that emergency medicine specialty. And the reason I took this specialty, as I was trying to say earlier, is it suited me very well. I had, as some of you can make out, I was trained in India and I came to this country. So I had a fair bit of training and experience in India as well before coming here. And initially went around doing lots of specialities and things like that. So I had good understanding of many of the specialities, both in this country and abroad. So it was easier for me to fit into an emergency medicine physician. That was one. And the second one is that it is a very fast moving pace. You never get bored. It's never like an anesthetic that you're sitting on the top of the patient's head and for hours, and the 8 hours the operation is going on, and you just you don't know what to do for 8 hours. You've got the patient in the operation theater, and you just can't get out of the operation theater. 8 hours you're sitting with the patient. Well, I thought that didn't suit me. It's not a bad profession. The other specialties are equally good, but it's different for every person. Has a different personality, a different way of working, and they have to choose which specialty that works for them. So that's how we got to emergency medicine. What is the future of current healthcare system? But talking about the future of a healthcare system, it's going to go. We are looking for more robotics. We are looking for more AI into this. We're looking for more more basically AI and software. A lot of software, a lot of changes in the way we do things and perform things are going to be a major this in and to actually achieve them is the biggest problem in terms of economics. So we need the money to get there, and that is going to be the biggest challenge. Okay, moving on. So you supervise students from Cambridge University. What do you believe is necessary to become Cambridge Med student? To be frank, I don't know the answer, what it needs to be a Cambridge Med students. I think being very bright, which all of you are. I never went to Cambridge University as a med student, so I wouldn't know that. But but from my experience with the Cambridge Med students, I think they're exceptional. They are. Some of them, I don't like them. I'll tell you why I don't like them. But most of them are entrepreneurial. They are. They have got. They are well read, well versed with the modern technology. They're not just medical students. They're not just into medicine. They have a whole full dimension of things that they are into. For example, the last batch I had, there was one boy his name was Ravi, whatever, I forgot his first name. So he was running a company along with doing medicine, right? So which was like amazing. I couldn't do that. I couldn't think of doing that. Then there was a girl who could speak 5 languages fluently. And I was just amazed how these people have gotten. So these are all a completely different creed of people that I'm used to. So, but yeah, they are also very disciplined in what they are doing. So that makes them slightly different to the other people from other universities and other places that they come. Okay. Okay, where was I? So do you supervise? Okay, what is your favorite part of the job? The favorite part of the job is doing a procedure, like cutting in somebody's chest and putting a chest drain in. It's not the favorite part. I won't say the very favorite part, but you get a buzz, an adrenaline surge when you do these procedures. So that's the best bit. Or putting a dislocated shoulder back in and doing it properly. That's the buzz. You get it. So, and you get instant relief. You can see it on the face of the patients. That gives you a buzz. So that's the favorite bit. And you, of course, like when your patients say, "Oh, thank you for helping me." That's the biggest buzz you can get. Does medical students you attend affect the job you get in the hospital? Example, would somebody who attended Oxbridge would be able to get a better hospital placement? I didn't understand this question, Shivas. Talk to me about it at the end. I'll try and answer that. How long are you working hours in a day-to-day basis, especially during the pandemic? Well, we were quite lucky because even though the pandemic hit us, we were not like other countries such as Italy or Spain. So what happened in Italy is the wards were full, their corridors were full, there were patients all over the place. They could not manage anyhow. So we prepared ourselves slightly differently. We said, oh, fine, anybody who does not need admission just because he has COVID, we will not admit. And that gave us a freedom in terms of we were able to have enough beds for the sick COVID patients. We had enough beds for, so it wasn't that bad. So we didn't actually have to basically extend our normal scheduled work. We just have to kept on, and on top of it, other activities were closed, like routine hip operations, routine surgeries or routine appointments. All were cancelled. Everybody was geared up to provide a service just for COVID. So we didn't have to actually go out of our way to deal with COVID patients as such. We just did what we did, but but at that time only COVID patients were coming. So the day-to-day basis in pandemic didn't change, and we were okay in that sense. It has now again picked up, and it is now extremely busy. Most of the hospitals have become again extremely busy as soon as we have seen the COVID go down. Okay. Anybody going to competitive uni affects your job prospects? Do you want to ask, is that question meant for me? Well, I can tell you something. It doesn't matter if you're not from Cambridge University or Oxford University or any other university. You will be treated the same as soon as you become a doctor. If you can perform, you will be respected and you will move ahead in the game. Not everybody from Cambridge will be moving up, will be having a progression at the right time, at the right place. Anybody basically reasonably intelligent, reasonably from any university can do well in NHS. I can't talk about other countries and things like that, but in NHS, anybody with reasonable intelligence has the desire to work hard will succeed. That's it. Okay. How, when doing teaching in a hospital, what do you suggest students to learn effectively in terms of soft skills, example, communication? So the Cambridge University, the soft skill is like communication and things like that is there's a huge emphasis. I don't do the soft skill teaching myself, but I do go and examine Cambridge students for the final exams and things like that. So I do check how well they are getting on or developing their soft skills, how they communicate with patients and things like that. And I am an examiner, but the soft skills, especially communication, is extremely important. Extremely important. If you understand, I'll give you a small example. 80% of the complaints we receive from patients is not because the doctor doesn't know what he's doing. It's not because the doctor is incompetent. It is because the doctor has not effectively communicated to his patients. So that's how important the communication is. So you're 80%, because I do the complaints, I do partly the complaints, I don't do the full complaints because it's a huge bag. But I do complaint. When my colleague is not there, I have to do the complaints in response. And I do the complaints. I know how effective, how we can reduce the amount of complaints just by having effective communication. So very important. Okay, has there been any increase in incidence of seriously ill patients coming to the patients who have been putting off seeking medical attention due to COVID? Yes, it was a big issue, especially just after the COVID, or we're still not out of the COVID. I mean, just around the peak of COVID, I would say, or just after the peak of COVID, we were seeing patients were not coming. They were at home with 3 days at home with heart attacks, with bowel perforations and things like that. And we were really seeing very sick patients. They were not coming early. But now things have changed. People are back and people are coming. We have record numbers of patients attending A&E at this point. So yes, that was I think that's why the government, if you follow the daily briefing the governments were doing, initially they were just reporting COVID deaths, then they started doing excess deaths. And these excess deaths covered or captured the number of patients or the patients who didn't actually die of COVID, but as a result of COVID, they died. So that is what the government was doing. Okay, let me take some more question. There's quite a few questions. Where was I? How do you cope with the large amount of information that med students learn at a quick pace? How do you cope with the large amount of information that med students learn at a quick pace? You mean how does you mean the medical students cope with the information, or did you mean how do I cope with the constant barrage of information related to COVID? I don't know. If you can IM me on that, I would answer your question. How do we ensure effective communication between doctors and patients? So this is what we do. And as you see from one of these effective communication is running simulations. And that is what I've been, you can see, if you see on this slide, we're running a simulations being how to be effective communicator, at what is the right words to be used in appropriate settings. This is just one part of it. Plus, the people who are, I don't know, but all specialities do that. But in our specialities, you have to do, you were supposed to do 2 exams, which reflected how you communicated with patients. So they are very important. You do not become an emergency medicine physician without being able to pass those exams. So it's very, very important. So we do lots of training, teaching related to that. We start quite early, and then we have there are courses, there are various other formats how to get to that. But there's lots of things. Okay. How do we ensure effective content? What is your most memorable patient encounter? There are actually lots and lots of fruitful patients encounter, not something that I could easily choose from, but okay, I'll talk about this. I mean, this is again back to communication. This is very difficult to choose this part, but we're just going to talk about this patient basically. In fact, I will talk about 2 patients. One is basically this is because you were all interested in COVID patients. I'm going to talk about COVID patients. So, and what we didn't know about COVID. So the COVID basically can cause any sort of symptoms that can relate to, that can be associated with any other viral illnesses. But for all practical purposes, we take 3 or 4 and we concentrate on them. So I had this patient who was basically coming. She was basically basically what do you call it? She was COVID, suspected COVID, but she didn't actually test positive. She had symptoms associated with COVID when she didn't actually test positive. And about 4 weeks later, she developed severe pain in her in her lymph nodes and in her groin, and she kept coming to different doctors and things like that, and actually she wasn't getting better. And then I saw her twice actually, and I said, first time I said, look, this is something of a gray zone. I'm going to treat you, but I'm not sure whether it's going to work for you or not. I think it is related to COVID, but I'm going to treat you anyway. So I treated her, and then she came back, and she was just ecstatic. Doctor, you just, I mean, it's so that experience that she coming back, and she just came and just completely hugged me, and that was quite a thing for me. She didn't bring any thank you card or anything. We just came to see me and just hug me. I just wanted to thank you and things like that. So that was really good for me. That's how I see that was quite memorable. And the other one was that I treated author, and then a few days later, she left her book that she had written for me to read in my test. So that was good. And so the two patient encounters, I think. How do we take on the next question? How do we effectively? How can we do effective work experience during lockdown? You can't do effective work experience at this point. I'm afraid it is with all other things. At this point, it is not possible to do work experience. I'm really sorry for your generation. It's nothing can be done at this point until we get the vaccine out and people are able to move out and go places then and mix with people, we can't do anything. It is really sorry that you're not being able to do what you should be doing at this stage of your training or at this stage of your life. I don't have the answer to that. What do you personally think is the hardest thing while being in medical sector? Nothing is hard. The hardest thing is to basically have that mental ability that I'm going to overcome everything, anything and everything that comes in my way. That is the greatest challenge. Nothing is hard. You just have to, it is your mind frame that is hard. Your mind frame that, oh my God, I'm inundated with having to do this. Your mind frame that, oh, I don't feel well, I can't go to work today. That thing has to go away. And that's especially what we see in the junior doctors. It's something to do with your generation, unfortunately, that you want to know all the information that is available, which is great, which we didn't have. We just walked with pure faith that this is going to work for us. Sometimes it did, sometimes it didn't. Your generation does not do that, in the sense that you will not move 1 feet ahead without knowing what is ahead of you, which is okay. But when you know everything, when it is safe to go, you will not go. That is where I have problem with your generation, unfortunately. I'm not talking about each and every individual of you. But many of you, including, and that goes including my children and my sons, who will not do things that basically is safe enough to do them. They will not take that leadership challenge forward. So that's my biggest problem with that. Okay, fine. Let's not go there. Is there any time during your work you feel it is mentally hard for you? Example, COVID, and if yes, how did you cope with it? I think I covered a bit of it. We are a slightly different generation. We know how to cope with mental hard work. We know how to cope with it because that's what we have learned. Because for us, if we don't cope with it, it will be physically very bad for us. So we will have to do with it. But certain tips I can give you. One is having a routine in your life, doing some sort of an exercise, some sort of it doesn't matter what exercise you like, but just routinely doing that. Some people can derive some, I used to in a way, but not so often, can derive some inspirations from meditations, from a bit of, you also have to relax, which is what is difficult with, that's I think where you guys get it wrong. Because for you, relaxation is going back to your Xboxes and start fighting, doing another challenge. So actually, you're not relaxing. After working for 8 hours in a day, you go back, and the way you relax is you're playing with your friend on an Xbox. That is why the problem starts. But for us, so for me, if I need to relax, I would probably reading a bit about astronomy. I would read a bit about things that I don't know, things that completely doesn't affect me in any way. And I'll be able to relax myself. I might meditate, I might do some yoga, I might do some exercise and things like that. And that actually makes you much more mentally and physically going forward. It's just my mantra. People have different ways of doing it. So you unfortunately will have to find your own way of going ahead with how to make yourself strong in this. Okay. Okay, how do you personally think is the hardest thing about being in the world? Where was I? When do you think we will be able to get work experience again? Do you think some junior doctors suffer from imposter syndrome or lack of confidence in their own ability? Yes, they do. They do sometimes lack confidence. But the funny thing is that they don't put themselves up. It's not that their knowledge is lacking. It's not that they have not worked hard. They just don't want to. I can't get them to put themselves forward. They're not able to step up to that leadership challenge. That's the problem with them. Once you start doing them, and being humble, being able to accept your own deficiencies is also equally important. Trying to listen to the other person is also important. So things like that are really, really important. I think, these things are important. I think I'm imposing too many, trying to impose too many soft skills on you. You will have to pick them up, unfortunately. But these are things that I feel is important. But some of you may disagree with me. That's absolutely fine. When will you be able to get work experience? Nobody knows for sure. Nobody knows for sure. We thought, but my understanding is if our vaccine really works, then from next February onwards, we should have a very positive effect, and we should be able to get back to normalcy from next February onwards. That's my personal thing. That's what I understand, but I may be completely wrong about it. Do you think, when do you think COVID will clear and we completely rid of it? Okay. So like I said, I'm looking at February because I really need to get this sorted. They really need to sort this COVID out, because next July I have to go on a trek in the Himalayas. So so it's really important by February they get their act sorted, and I can go. Something I didn't mention is that I have a friend overseas. He's a professor in one of the medical schools in India. So so we meet up, and occasionally he gets a whole bag of his medical students who come with him. And then we go up climbing some small mountain top or something of that. So we do it very often. And we had planned something this July. And unfortunately, we couldn't go because of the COVID. And I'm really looking forward to do it next year. So hopefully by February, everything is clear and I can travel and I can do some trekking up in the Himalayas. How do you think we will manage this winter with COVID and the flu? I'm positive. This is the question that many of the health managers are facing at this point. How will we manage with so many numbers and so many COVIDs and so many flus and things like that? I'm positive. What we are hit now is basically lack of investment in the health sector. As a result, we don't have enough capacity to deal with high numbers and so when you go to our hospitals, they are crowded, crammed, and not fit for purpose for this century or this millennium. I'm positive because the government is making a lot of initiative to provide extra money. They have realized that they have got it wrong. They're providing extra money. They're providing. They are building up. They have promised to build up new hospitals. They have. So we are getting a new hospitals in next 5 years. We should be getting a new kind of an extension of a department by January. The work should be finished. So even if we find it a bit difficult, I think we would get there by February, and we would be absolutely on top of the game, actually. So I'm hopeful and I'm positive that we would be able to manage and cope with it. What is the difference between your expectation and the reality of being a doctor? Expectations is always very, very high, and then this is also, I think, that happens with a lot of young people. They become doctors, and they've been thinking, oh, when we become doctors, that's it. It's going to be really smooth and things like that. But life isn't smooth. It's never been, and it never will be. There will be ups and downs. There will be new challenges every day. Just like COVID, there'll be other challenges. Even if COVID is gone, there'll be other challenges. And we'll have to face the challenges every day. We just cannot give it up. We have to be resilient. And this resilience comes with your own development. And, you have to start being also, be thankful of the privileges that you have. And you have to compare yourself with the guys who don't have the privilege, and develop that resilience. How these guys have developed this resilience, and you need to start to thinking, oh yes, I'm also going to develop this resolution. I'm also going to face these challenges with strength and vigor. Yeah, basically, you have to build up to that. So what I was trying to say is that don't think everything is going to be really smooth and pleasant. When you go to university, when you get out of university, when you finish university, when you are as a doctor, when you are as a middle grade doctor, when you are a senior doctor, there will be challenges and challenges and challenges. There's no end to it. Every day there's a new challenge. You need to be aware this is going to happen to me, and you would face them with courage. Okay.
So, sorry, just to interrupt. I think we'll just take one more question, because I think there's been so many questions and you've answered so much. We'll just take one more question.
Okay. Which one do you want me to take on?
I think you should, whichever one you think is the most important or like the most pressing concern. It's absolutely up to you.
Why do you think London was given the most PPE as opposed to other areas? Why do you think the need for change in healthcare system? What do you think needs to change in healthcare system for it to be fit for purpose, especially with an aging population and likelihood of the future? Yes, I'll take this question from Nabiullah. Is that right? Have I pronounced it correctly? Whatever. If I'm not, I'm sorry. So what else do doctors do apart from treating patients, and how could you improve the NHS? So, well, that's something basically you generation we are counting on, because we couldn't do it. So it's your job to do it. First of all, you had the most important, what I feel is that you have to learn, and not just learning from your surroundings. You have to learn from other places, other countries, other ways of working. so that you are able to incorporate all this to make a better NHS. And so I would encourage all of you to take a year out or take some time out to do something abroad. Many of my colleagues are working I mean, I don't know, with the COVID, they're probably not working, but we have a EM global group, which is like people go to other countries, work for 2 to 3 months, and then come back and join the NHS. It does two things for them. Personally, they learn how, they don't learn, what I mean is they learn to appreciate what they have in comparison to people living in Africa, Africa, India, or anywhere else. That's one thing that happens very, very effectively. And they learn, because you go anywhere else, you try to impose what you have learned from your current standards and try and put it there. And you learn that all that you thought was right may not be right in a different circumstances, in a different country, in a different environment. But you also understand, but it also teaches you the difficulties that is there to implement anything that you want to implement. Although it is incredibly difficult, if you are persistent and continue to make changes, you do achieve something. You do, what we are looking at is that for clinicians like us, we would be able to make very little changes. The actual changes comes when the government wants to make a change. So that's where we are limited. But if a lot of you get together, then you can make these changes come more quickly and rapidly, and the good changes. So what I would say is that many of my colleagues, they work overseas and get experience overseas and things like that. That is something that I would encourage, and I would like you to bring what you learn. So the people going to say, this is one aspect I've already decided, told you how it helps and helps yourself to develop yourself. The other aspect is, say you work in America, or you work in Australia, or even in Hong Kong, or in China, or maybe in Dubai, or any other country. When you come back, you carry some of the things that you have gained and learned there, and you try and put it into the NHS. And sometimes it works, sometimes it doesn't. But even if all of us do a small change, we think we would be able to make a big change over a long period of time. I mean, it won't be happening in 1 year or 2 years, but over a period of 3-4 years, we would see a big change come into NHS. That's what I think would be. That is what I think would help improve the NHS, and that's how I think we can improve the NHS. Just carrying out the stereotype way the NHS is working is not going to improve the NHS. Thank you, everybody.
Thank you very much for that talk, sir. It was very informative, and I learned so many things about that, especially the dedication it takes to become a doctor, and especially a consultant. Thank you very much for coming and agreeing to talk to us. If anyone has any more questions, is it okay if we pass them on to you? They can ask us, and then we ask you. Okay, thank you very much. So, if anyone has any more questions, please feel free to ask us on Instagram, email, whatever, and we'll pass it on to sir. Otherwise, thank you very much for coming. Thank you, sir, for giving a great talk. And
thank you.
We'll see you guys next week. Bye, everyone.
Bye, everyone. Bye.